Thank you so much for everyone that has logged in. My name is Rebecca Mazer, and we're going to be doing a 1-hour Ask Me Anything session with my two amazing guests. I'm going to let you guys introduce yourself here shortly. Just some quick housekeeping. A lot of you that have logged in have already submitted your questions. If you have any questions as we go along, please don't hesitate to use the Q&A button right at the bottom. Those will be posed live. And I can ask them live, or if you want to ask me a question specifically without it showing up live, you can do that as well. I think you have the option to post it live or through the chat. So let's get started, guys. Again, thank you so much for being with me. We are hosting these 1-hour webinars weekly with our different doctors from different schools and different markets. So we just want to talk about your experience and give our guest a chance to ask you guys questions about Aspen and how you guys are doing. So for those of you that don't know me, my name is Rebecca Mazer. I am the senior manager for the academic and relations team, which is part of the talent acquisition team. So we help with the hiring process. We do a lot of the events and the socials. I'm pretty sure, Jeffrey, that's how I met you. And Jimmy, I probably met you at an event. So we've done a lot of really, really fun events and socials, and we basically put you guys in front of the doctors and answer your questions and make it so that you are able to shadow and jump on board with us when you are ready. So that's my role, and I'm here to support you guys and answer your questions. So if there's anything that we don't answer tonight, you're welcome to reach out to me personally, okay? And then docs, I'll let you guys introduce yourself. Jimmy, you can start.
I'm Dr. Jimmy Schooley. I graduated in May of 2019. I've been with Aspen since January of this year. What else did you want to know? Fun fact, I use the same one every time. I say that I was in a movie and people are like, oh, a movie? And I was like, oh, I was actually an extra in a movie. And they're like, well, that's still counts. I was like, it was an extra in a Lifetime movie. So it wasn't actually, but that's my fun fact. It was with Kristen Stewart, so I say before Team Edward and Team Jacob, there was Team Jimmy.
Okay, so you're gonna have to tell us the name of this movie so we can Google you and IMDb you.
It was called Speak.
Speak. All right, so I'm hoping all the attendees have written that down.
No, I don't know about that. It's back when I was in 8th grade. I had like a bowl cut, so it's pretty good.
Okay,
so
we're gonna
you're
check that
a kid in this movie,
I was a
kid extra.
I was pretending to be a high school.
I love it. I love it. That's a great fun fact. All right, Jeffrey.
Hey everyone, I'm Dr. Jeffrey Lee. I graduated from Midwestern University, Illinois, this previous May 2020, and I joined with Aspen in June, middle of June. And fun fact, I literally just adopted a dog, or 2 dogs. We were thinking of adopting 1 dog. We somehow ended up with 2, and we just brought the second one home like an hour ago. So please pardon if you hear any barking and stuff outside.
I love it. I love it. Well, I'm so glad you guys are on tonight. Again, thank you so much for doing this. I reach out to you and I'm like, so you're going to do this. I don't have an option, right? But no, thank you guys again. I know that a lot of our, attendees and students want to just kind of hear your experience, how things are going, what your story is, and how you ended up with Aspen. So we'll kind of get to that, but we'll get started because we have quite a few questions that have populated already. And again, if you guys have any questions as we go, you're welcome to add them right down at the bottom on the Q&A section. They'll pop up on my end. So you guys will see me kind of going back and forth because I have just different screens and I have all the questions here. So I'll ask, and again, if there's a follow-up that you guys might have, shoot it over to me, okay? So let's get started, guys. The first question that popped up was, what advice would you give a new grad on private practice versus DSO? Now, I'm gonna ask you, Jimmy, because you've worked at another practice before you joined Aspen. I know it wasn't a private practice, but it was another DSO. So tell me a little bit about that experience.
So I always tell people, you can't go wrong. It's just kind of the situation you find yourself in. I worked for another DSO before Aspen. I actually was down in Virginia for about 6 months, so I worked for a DSO down there. It was a good experience. I like obviously working for Aspen more, but my dad and actually my grandfather were both dentists. They both had private practices, so I've seen kind of both aspects. There's pros and cons. For me, the big benefit with the DSO and specifically Aspen is just the amount of like resources and kind of all the built up knowledge that they've acquired over the years, because there's so many practices. They've seen what works, what doesn't work. This goes well, this doesn't go well. You can see metrics that say this is the type of, it just breaks down your patient populations and your numbers, and you can see this is an area you want to focus on, this is one that you don't. And there's also so much CE, like we were actually talking before you guys hopped on, they're going to be doing a big focus on implants moving up. So they're going to be doing some live courses and a ton of CE, not just with implants, but really there's endo ones I'm getting email on every day. There's all kinds of different things. So just the CE, the resources, and you can hop on and call another, you can see any doctor from any office and say, hey, how's this going for you? What's working, what's not working? You just kind of have a really good support system that can really help you out, especially as a new doc. Like when I came out, I felt like, I mean, you know stuff, but you learn more during your first year. I mean, your first week, you learn so much. So when you have a support system, it makes it so much easier coming out of school.
I love that. Now, let me ask you a similar question, Jeffrey. It's just a little different. The question is, why did you choose Aspen over a DSO or private practice? So what made you jump on board?
Well, I've had previous friends from that has branched out to multiple different DSOs, and I kind of got their inputs. I know some offers more CEs than others. Some had a support system, some didn't. For me personally, I really liked Aspen's, the CEs and the mentoring program that they have. For the people who don't know what the mentoring program is, most offices is whether or not you join, if you're the sole doctor in the office or if you're an associate with someone else, there'll be I think a 60-day training period or something, or 4 weeks training period. And then they'll go through everything. They'll train you through like procedures. It's basically like competencies in school again, where you're not really tested, but you have another doctor watching you, making sure that you're okay, you're comfortable. So that's what caught my attention. And plus all the free CEs and stuff. There's like a buttload of them. Like you don't have enough time to do all of them.
Yeah.
So,
yeah, I love that. I mean, one of the questions that did pop up was about mentorship. It was asking what kind of mentorship that, does Aspen offer? So you really touched on that, because we do offer the 4-week onboarding, right? And typically they give you a mentor for another 4 weeks. So you have 8 weeks working alongside a mentor, so that you are comfortable and that you could start kind of building up your skills. Do you still have, both of you guys still have connections or keep that network going with your current mentor?
I work with my mentor still, or like he's a practice owner, so I work with him daily. And
so your mentor was the owner of the office that you were working
at? Yeah, and he still works there. So
okay. And Jimmy, did you have a mentor?
In our case, our owner actually owns probably, I want to say like around 20 Aspen offices in Ohio, but he actually does a really good job of basically hopping between each different office at least a few times a month there. And on top of that, within each city, so I'm in Columbus, but we have Columbus offices, Cleveland offices, different areas in between. You have kind of doctors that have been with the company longer, that if you have a question about like this case or something you haven't really done, you can kind of call them up, and even sometimes you're able, depending on if you get coverage, you can even get them to either come over to you or go over to them and do some cases. So there definitely is mentorship available, kind of whatever you need. And one thing I thought of for the last question too afterwards, is about comparing like one DSO versus another, or even private practices. There's something to be said about stability. I've had some friends actually within the last even few months that joined either a private practice or another DSO, and just either because of COVID or different situations, they had to go out of business, or they didn't end up having the schedule they thought they were going to have, or things like that. Versus here, yes, I mean, there's things that happen, but in the long run, because like I said, they've been at it for so long and they know what works and doesn't work, there's a lot less chance of something going wrong than in a practice that might be new and up and coming. It might sound great, but it actually isn't what you thought it was going to be. So I just thought of that because recently I've actually had a few friends reach out to me trying to switch jobs just because they've had situations come up. So
now you do know that we offer that $10,000 sign-on referral, right? So send my way. So I'm glad you said that, Jimmy, because we have a lot of students, 2020 students, in 2019 grads that are reaching out and saying, hey, my position fell through, or The job that I was working at no longer has the patients that can support two doctors. And obviously the owner doctor is taking all the cases. I just had a conversation with a doctor yesterday, 2019 grad. She reached out to me and said, hey, I went from working full-time to working part-time. And, I went from seeing 6 patients a day. Now I'm seeing 2 because all the owner doctor's taking everything, which I understand it's his office and, he needs to survive. His practice needs to survive, but it kind of put me in a predicament. So now I'm looking for a new opportunity. So the great thing is Aspen's doing really well. We're opening, I think, probably 80 offices by the end of the year. So we are definitely hiring. And COVID did make an impact. So we'll talk about COVID here in a little bit because there are some questions about COVID. So COVID did make an impact, but I think we've kind of come back stronger and better than ever. And I think we're doing well. Do you guys agree?
And even in situations like that, like let's say you're in an office that maybe because of COVID is a little slower. The nice thing about Aspen is compared to my other DSO, there's no like negative payback where after a certain number of months you have to start giving back. You always have a guaranteed rate, and then depending on your position or kind of your contract, you can bonus on top of that. So in my situation, I've bonused every single month, but I always know that for some reason, if something happens, I always have that base guaranteed salary. So I could see, like you said, 2 patients a day and I'm still doing okay. So that's a nice kind of relief, especially in times like this, that you're not going to be struggling if kind of shit hits the fan. Sorry for the language.
Right. No, totally cool. I'm glad you mentioned that because one of the questions that did pop up was, do you have a daily guarantee? How do you pay? Is it based off production or collection? Are you guys both pretty comfortable with the way you get paid? Do you understand the structure?
Mm-hmm.
Okay. So for those of you for whoever asked, we offer a daily guarantee, which never goes away, right? So that would be, depending on the market, 500, 600, 700, I don't know, depending on the market, where you work, that's your daily guarantee. That's your salary. And then Jimmy, you mentioned like an incentive or a bonus. And Jeffrey, I'm sure you have that too, where you can make a percentage off the production of the office. Now,
the office as a whole, including the hygienist and the other doctors.
Touch on that, Jeffrey. It's not just your production. It's
the entire office. So say your office has 3 doctors and like 4 hygienists. It's everyone's production. So everyone's production added together, all the hygienist collections or production all added together. And then depending on your patient loyalty score, which is basically a survey that patients fill out after their appointments to see whether they were happy or satisfied with the service that you've provided. And if they are, the higher percentage or the higher you score, the more of that percentage of the profit you get from there. And depending on whether you're an associate or an MCD or an owner, there's a different range that you get from there.
Now, for those that don't, we use a lot of acronyms at Aspen, right? An MCD is a managing clinical director. It's basically a lead dentist. Jimmy, you're a lead dentist. You're an MCD, and then Jeffrey, you're an associate. Jimmy, you're an MCD. You graduated 2019, so you came out with some experience. You had already worked at another DSO. So when you got hired on, as a lead dentist.
Sure.
And, Jeffrey, you mentioned that your owner doctor has said that you have MCD material. So hopefully you have that opportunity to transition into a lead soon.
Yeah, just waiting for him to bust down the door next door, the vacant wall, basically.
I love it.
He's trying to bust it down. He's in the talks with the building manager right now. So
to expand the office?
Yeah, to expand the office.
Oh, that's fantastic.
That's his idea right now. So.
Okay, there you have it. I love it. So a question that popped up right now, guys, is how do you apply with Aspen and when is the best time to start applying? So let me ask you, Jeffrey, just because I know you just started. When did you start your interviewing process as a D4?
Let's see. So in general, I was looking not just with Aspen initially. I probably started around February or March, right before COVID all happened. And then I didn't start getting into interviews until like middle towards the end of March, I believe.
I'm going to call you a liar.
What do you mean?
I'm pretty sure I went to an event with you like in January or even early February, and you started talking about your interest in the Ohio market.
Sure.
So we had you interviewing probably in February.
Well, that's when Joe Burrow, we thought he might be coming down to Cincinnati, so everyone wanted to get down there.
True story.
True.
True story. So yeah, you're fibbing. You definitely started earlier than that. And the reason I say that is because I want to say, I'm not going to lie, guys. I want to say March is almost too late.
It is.
When did you start interviewing? When you graduated, right before you graduated, when you were a D4?
Are you talking to me?
I did say Jimmy.
Sorry, you cut off for a second. Maybe my reception.
I'm sorry.
No,
Jimmy,
you're fine.
when your D4 year, when did you actually start your interviewing process?
So I'm in like a unique situation. My brother actually signed on with Aspen when he graduated a year before me, so I already kind of knew about them. But I'm also very I like to look at everything. So all of D4 year, even though I had Aspen kind of in the back of my head, I looked up basically I went to every single lunch and learned, A, because I wanted the information, but B, I was that guy that never took lunch to school once in the whole year, and I had lunch and learns every single day. So I went to every single one, got all the information, kind of made like a chart, like saying, this is the company, this is the benefits, this all that kind of stuff. And every single time it just seemed like Aspen was kind of, definitely comparable to everything, if not better, in all these different categories I was looking at. And then on top of that, I think the thing that differentiated, and it's kind of unfortunate this couldn't happen this year, but I went to the Vibe session. I forget when I went my fourth year. It probably was sometime. That's when I met you. Maybe it was maybe in early spring, late winter, or something like that.
I want to say you went to the October Vibe.
It might have been that actually. And I went there, and it was just like, Aspen was just so, I know it's an event and like you can kind of do the whole hurrah, but like they were just so on top of everything, like from the hotel rooms to the events to everything. It was just like, wow, like they're really on top of their stuff. And that just kind of solidified everything that I'd seen on my chart there. So I want to say kind of throughout my fourth year, I was looking because like you said, like, especially some people in the class, they'll start really early on and they'll snatch up a lot of positions. So you kind of want to have an idea. Obviously there's no rush, but you kind of want to be looking just in case an opportunity pops up. And like I said, this one from the whole time was really where I was looking at.
Absolutely. So I'm gonna talk to you guys from a recruiter standpoint. We've already hired 2021 grads, probably 5 or 6 have already applied and snatched up, like you said, positions. I want to say March is almost too late because a lot of the D4 start looking for jobs and start interviewing like in October, November, December. And a lot of folks are signing contracts or agreements by January. So if you're, that procrastinator that says, oh, I'm going to wait, by March and April, every position that you thought you wanted is taken. Or all like the hot spots, right? Like Chicago, and all these areas that students want to be are the places that go fast.
Or even within a market, like there's like in Columbus, for instance, there's a bunch of different offices, but some offices might be more of a situation you want than others. So you want to have your pick of where you're going to go, as opposed to, oh, we have an opening for you, but it's this office and you wanted to be in another one. So the earlier you hop on it, the more opportunities you have.
Yeah.
So that was like me too, because
you wanted to be in Cincinnati, right, Jeffrey?
No, I actually landed the office that I'm currently, because it's like 10 minutes away from my home, but my initial offer was like an hour away. Okay. So then I lucked out that I was able to get into this office. I probably would have had a higher chance if I had applied earlier, but
right. Because one of the questions that popped up was, did you guys end up in the location you originally wanted to be in?
So I'm actually in the location I want to be in, but and this goes to, I think you said one of the questions is how you go from a associate to an MCD. I was signed on as an MCD, but kind of what I've seen from other docs in the area is usually your first year-ish. It can be earlier, it can be later based on kind of your skill level and kind of how you adapt to things. But you can do anything ranging from being in an office with another doc to floating to different offices. So sometimes you might be in an office starting off that's not exactly where you want to be, or you'll be floating around to different ones. But if you've been there and you get experience and you kind of show your skills, then you're able to, like Jeff said, he was able to get into the office he wanted to be in. So yeah.
That's awesome. Now, Jeffrey, tell me a little bit about your transition from student to dentist, because we have a couple questions where folks are asking, How long did it take you to transition, your speed and get started after dental school? So talk to me about your speed and how you feel like you're doing with that transition.
Well, so for me, I got kind of thrown into it. Well, let me take a step back. So I don't know if this goes for every Aspen office, but then for at least our office, they told me that they'll hire me as a DA, a dental assistant first, until I got my licensing paperwork all in, because like I was waiting. Because after you graduate, then you can submit for your license. So while I was waiting for my licenses to come in and my DEA number and stuff like that, they hired me as a DA where I can just shadow the doctors. So I did that for a week, and then my main doctor one day told me I need to leave by noon since my father-in-law just passed away. So here, Dr. Lee, take my schedule. You're in charge of the office today. So I'm like, oh shit. Well then. So I kind of got thrown into the deep end. Usually it doesn't happen that way,
Yeah.
but then you'll usually adjust within the first few weeks. Because I know during the mentoring program, the doctor will start feeding you like slowly, like, oh, here's a couple of restoration. You'll take stuff from their column first, and they'll make you do like, oh, some overflow. Overflow is like denture steps or like post-ops, just so you're familiar with how the office flows and stuff like that. And then once you start feeling comfortable, they'll start giving you more and more until you eventually have your own column while still seeing new patients and overflow and stuff like that.
So right now, Jeffrey, how many patients are you seeing on average?
On average, so in Aspen, you have 3 chairs. Your production chair, which is like fillings, extractions, all your big crown preps, bridge preps, all your big stuff. Then you have a new patient chair where new patient comes in, you do like your comprehensive exams. And then you have your overflow chair, which is like denture steps, like wax bites, impressions, post-ops, denture adjustment, stuff like that. So on average for my office, on a regular basis, I see roughly 8 productions, probably me personally, 5 or 6 new patients, and then like 10 overflows. And then my doc sees like the same amount as that too, so.
Okay. And then Jimmy, how many are you seeing?
I mean, it varies on the day. I just actually pulled up my numbers just now because, again, you can look it up. I see probably last month anywhere between 6 and 7 new patients a day. It says existing patients a day, like 23-ish, but that's kind of, I always tell people it's a misleading number because some of them is, like you mentioned, your production column, your extractions, your crowns, your fillings, your things like that. But a lot of them is your overflow column. So it's like a wax bite, you go in there for 5 minutes. A wax try, you up, oh, it looks good. You have them bite down, try the different things. A lot of the patients, they're in and out in less than 10 minutes. So yeah, you see, I mean, on average, I'll see anywhere from 25 to 30 in a day, but a lot of those are like 5 to 10 minute procedures. And the nice thing is you kind of can control your schedule. So if you need, I always tell this story. When I was with my other DSO, I probably did 15 extractions in 6 months. And I wasn't really comfortable with extractions, and I came here, and I know, because with Aspen, you do a lot of extractions, a lot of dentures. It's also very profitable, so I like that. But I was like, oh, my speed is not there. So I remember I first got here in January, and I was giving myself like at least an hour for like one tooth. And then within the first few months, I'm doing like 10, 15 extractions a day, and I'm able to do a full mouth in like an hour or less sometimes. So you really pick up your speed, but you can kind of say, hey, at the beginning, I want more time to do this. I was better at crowns, so I said I don't need as much with crowns. So you can kind of adapt your schedule however you want. And that's what I tell people. Your first year, you kind of change in 2 ways. One, you learn your skills. Like you learn how to do every single procedure better, whether it's extractions, crowns. Like I remember my first day as a dentist, I walked in there and it was in Virginia, and they were like, you need to do it was for an implant crown, and I had to do an open tray impression. I was like, I don't remember this at all. So I go in my office and I'm YouTubing how to do an open tray impression or whatever like that. Went perfectly fine, but now those kind of things are a breeze to me. So you learn your skills so much in the first year, but the other thing that you just naturally pick up is how to manage an office, and that's how you transition from an associate to an MCD. Like, when you're in your production column, you can pop in there, get the patient numb while they're getting numb for 10, 15 minutes. You go do a new patient exam. You hop in, you kind of learn the flow, because at first you're like, oh my gosh, there's all these patients. But after a while, it's kind of like a breeze. You're just kind of going back and forth, and just
Yep.
it times up very perfectly once you kind of get a groove. So that's the other thing you kind of learn within your first year or so.
I love that, because that's a great transition into this question that just popped up. They're asking, how much time do you block out for each new patient? Do you feel like it's enough time to build a relationship with them? Who wants to answer that? Both of you guys can. So how do you manage your time and how long you're actually spending with those patients? You kind of touched on that, Jimmy.
Our new patients are blocked for an hour. I actually, compared to a lot of dentists, I actually spend more time in my new patient exams maybe than some do, because I like to develop that rapport. Because I mean, a lot of people, as you know, don't like going to the dentist. So one, you want to make them comfortable there. And on top of that, if they like you, they're more likely to want to do the treatment that you tell them that they need. So I'll sit in there and I'll talk to them and I'll go through in depth, and I'll explain, this is your option, this is another option. And I make sure they're not feeling pressured, because at the end of the day, they can do whatever they want to do. But if they feel like they trust you and you've explained everything real well, you can get a really high conversion of people saying yes to your treatment. So on average, I mean, it really depends on like if someone comes in and all they need is just a cleaning, I'm in there for like less than a few minutes. But sometimes I'm in there for 10, 15 minutes going over things. It also depends on what's going on in different rooms. But I mean, you definitely, I'll hop in there, I'll kind of go over everything. And then our hygienist will also go in, probe all the teeth and kind of go over the periodontal aspect of it too. So all in all, they're scheduled for an hour, and they expect to be there for about that long, between me, the hygienist, and then the office manager kind of going over the treatment with them.
Really quick, and I'm going to let you answer, Jeffrey. From my understanding, do you guys have that conversation either with your mentor or with like your PSR and say, this is how much time I think I need with each patient or with each case when you first start, just to kind of gauge your speed? Jeffrey, you have company. Someone just showed up. That was awesome. It was a bit of a creep in and creep out. So did you have that conversation with like your PSR saying, hey, with this specific case, I need this much time. With this specific case, I need this much time, just to kind of feel it out, and then you get better, faster, whatever the case is?
Well, initially when I first started, they asked me, hey, is this enough time for you to do this? And I'll take a look at the x-ray and I'll kind of gauge, I think I need a little bit more. So they'll just drag my column down a little bit. But they're really easy to talk with. Just talk with your PSR, your office manager, or whoever, and then they'll adjust that for you to whatever you're comfortable. Whatever you don't feel comfortable doing, they're not going to make you do it. So that's the beauty of it. Like if you don't feel comfortable with it, just say, hey, I'm not comfortable with this. Like, I don't think my skill's up to par to this. I don't think I can do this. It's okay. They're not going to hate you for it. They'll just reschedule with another doctor or find another way to do it from there.
Good. I'm glad you said that. So do you guys, I mean, there's a question in here. I have to kind of scroll through all the questions, but do you feel like you have full autonomy and you do what you're comfortable doing at all times? Do you ever feel pressured into doing any specific procedures? I know there is a question about quotas too. Do you have to hit a specific number of cases or quotas or anything like that? Talk to me about that.
That's the nice thing that you were talking about. Like we were mentioning the incentives earlier, because I know some places, like actually where I was before, you didn't profit at all from sending something to the specialist. So the specialist got all their production. Here in Aspen, we have oral surgeons that come in, endodontists that come in, and you get a portion of their procedure. So actually, if something seems like it's out of your capabilities and you send it to them, you're actually benefiting from them doing a procedure, and it's making your life easier. And like we have a great oral surgeon, he comes in and says, hey, if I'm free or you're free, you can come in, watch this procedure. If I want to practice, if I want to try something that might be a little outside of my comfort zone, he'll come in and do it with me. So that's the nice thing, where you don't feel pressured. And on top of that, like the thing that I've learned that benefits me is if you look, because you can look at your schedule as far in advance as you want. I always look a week in advance every single day. So I look through the schedule for a week and I say, oh, I may need a little more time for this or a little less time for this. And by the time the appointment comes up, you have everything kind of timed up exactly how you want. Because some people have the misconception, the more people you see, the better, and the more you're going to produce. I actually think it's the opposite. Sometimes if you have a very efficient schedule, I'm actually doing less work now than I did when I first started, but we're producing a lot more because everything's timed up and you don't have patients waiting. You don't have people getting upset because they're waiting. It just makes everything way more smoothly. So you really have a lot of autonomy to do kind of whatever you want.
That's awesome. Jeffrey, do you feel that way? I know you just like literally recently graduated, and how do you feel about some of the procedures that you might not feel so up to par with?
Whatever I'm not up to par with, I would just refer. That's what my doc said to my practice owner. He said, whatever you don't feel comfortable, don't even bother. Don't get yourself into any trouble. Just do what you're comfortable with, and then we're all going to be happy. So I refer a lot of complicated extractions to our oral surgeon, same as endos as well. If I'm thinking, oh, that realistically, if you're going to spend 4 hours on a root canal, in a profit standpoint, it's not really that profitable, and you're not learning as much. In that 4 hours, you could have done so many other procedures that you could have learned more in. So with those, we tend to refer out just because of the timing, like how long it takes you to do it. It's just not worth your own time even.
It's funny you say that because we had a float doctor here at my office a couple of days, and I was telling her, like, I when I graduated dental school, I was like, oh, I want to learn molar endo and I want to do all this kind of stuff. And maybe at some point I will, but I was doing a lot of my anterior endo at first, and I wasn't as skilled at it at first. And when you're spending like an hour or so, hour and a half doing these kind of things, and that same amount of time you can do basically a full arch extraction. I mean, rough numbers here, you might get $500 for that endo, but you might get over $5,000 for an extraction and an insert. So just from a profitability standpoint, like you kind of learn like, hey, I can do this, no problem. But sometimes it's better just to refer and have them spend 15 minutes on something that you're going to fumble around with for an hour and a half.
Absolutely. Now, do you guys have specialty in your office?
Not it.
Either or. Jeffrey, what do you?
Not
Jeffrey.
So not exactly in our office, but our oral surgeon does come to every 2 weeks into our office, and he does a lot of his implants and like full mouth extractions and complicated extractions. And then endo we refer out.
Okay. And then Jimmy, do you have endo or oral surgeon, you said?
We have oral surgery. He comes to our office about 2 to 3 times a month. I think we're between endodontists right now. So I know Cleveland has an endodontist. Columbus is getting a new one. So right now I refer out, but that's the other thing. You develop good relationships with other specialists in the area. So I love it. He's not an Aspen guy, but I send it to an endodontist in the area. It comes back. All the cases are great. He gets all the decay out, and I just go in there, prep the crown, and I'm done. So it's great.
I love that. And I mean, they refer folks right back over to you. So it's a good
and they send me some chocolate sometimes too. So it's great.
That's nice.
We get cookies.
I love it. Okay, so I got a question that just popped up, and I'm not sure if I understand the question, so I'm just going to read it. Do you feel like you ever lack numbers of patients? So I'm not sure if they're asking, do you ever feel like you don't have enough patients? Whoever asked that, if that's not what you mean, please submit another. Do you guys ever feel like you lack patients?
I feel like we have too many patients. No, because like, so our new patient column is always filled. Whether or not, if your column isn't filled, Aspen Call Center will put new patients into that column for you. So then your new patient column will always be filled. You're going to see at least 3 or 4 new patients a day, if anything. At least in our office, we've never had an issue with seeing new patients. And then whether or not who gets to see that new patient, it's up to the office, I guess. How our workflow is, whoever can break away from the production just goes and sees the new patient or overflow. So it's me and my other doctor, we just kind of intertwine. Whoever's free will see this new patient, and then you'll just do their treatment. Or like if there's a treatment that you wanted to do for a certain patient, I just talk to my doc, say, hey doc, I want to practice on this. Can I see this patient instead? And he said, yeah, go ahead, go take it. So it varies. Just get to know your doctors and like be friends with them, and then they'll help you out.
I love that. So a question that just popped up was, what does your training at Aspen look like? And how long do you get? So I know we already touched on, you get 4 weeks. What do you do during training? What did that consist of?
This binder, this thick binder of a bunch of paper. This is basically that 4 weeks mentorship program. It just goes through everything. Like there's stuff on restorations, like what their ideal preps are. And I think there's some endo, some extraction stuff, bridge work, stuff like that. So you kind of just go over that, and like you meet with your mentor like every week to go over some self-assessments and stuff like that, seeing how you're comfortable, what would you like to work more on and stuff like that.
Jimmy, did you have the same type of onboarding, or was yours a little different? Since
Mine was slightly different just because I'd already been practicing. I was kind of familiar with the DSO kind of setup. And I actually came, when I moved up here, I finished work on a Friday down in Virginia. I moved up here, or I came back up on a Monday and started. I trained with one of the senior docs for about like a week, and they were like, he's good. So they just put me in an office after that. So, but it kind of like, that's the thing. You can kind of, they can give you up to as many weeks as they want, but if you kind of don't need that, they can kind of adapt it to your abilities. So that's what's nice too. Like if you feel like, hey, you got it, then they might move you up a little bit, progress you a little more quickly.
Yeah, that's what happened to me. I didn't use up my 4 weeks. I progressed like after a week and a half. So
That's awesome. Now, Jeffrey, you were saying that you feel like you learned more in like a week than like your whole time in dental school.
yeah, it's a lot, since everything's more fast paced, and just the sheer amount of patients you get in a day, you kind of see more. Once you get into the flow, which really only takes about a week or two to start understanding how to break away from your main chair to like your new patients into overflow. Once you get that down, everything just falls together. Like it's not too bad. It seems overwhelming at first when you first look at your schedule, like, oh my God, I have like 15, 20, 30 patients a day. But then as what Jimmy mentioned earlier, a lot of them are just like overflow, and that just takes like 5 minutes, not even 5 minutes sometimes. So it's not that overwhelming, to be honest.
I'm glad you mentioned that, because a question that just popped up was, what has been the hardest adjustment in the real world working as a dentist? So do you think it's your time management, or, I mean, humor me, what has been the biggest adjustment going from a student to a real world dentist now and actually working with patients every single day?
Go ahead.
Go ahead, Jimmy. Go ahead.
I was gonna say, I would say not the hardest. It's just, I mean, I think this is the case for anyone, and obviously everyone has different things that they think are the hardest. But for me, is just like when you're in school, you have faculty, people like right there. Like when you're looking at x-rays, like, what is this? You're not quite sure, because in dentistry, you learn how to do like an ideal prep, and you learn like this is what decay looks like. But in the real world, there's so many things that you're never going to have seen before. So you'll be looking at something, you might remember it, but that's the nice thing again that we've talked about, is you have mentors, you have people. Like I literally today had a patient come in that had a cleft lip, cleft palate, and because of that, it caused 2 of her teeth to actually migrate away from each other. And she was like, can I do something with my veneers? And I had no idea. I hadn't remember something. So literally I just went in my office, FaceTime my oral surgeon. I was like, hey, what's the situation? He went through, explained everything. And it ended up being something we we're going to refer to the university for. But just like things like that, where it can be stressful at first, but you got to realize, A, you're not expected to know anything. You have specialists. And B, for a lot of the more common stuff that maybe you just aren't as familiar with, you can call up another doc, you can call up your own, or you can call up a specialist and get answers pretty quickly. So it's overwhelming, but once you realize you have those resources, it's not so stressful.
Do you feel the same way, Jeffrey?
Yeah, pretty much. There's going to be a lot of stuff you see that you've never seen before. You don't even know, or maybe you've seen it in school, but you totally forgot about it because it's not common. But then, as Jimmy said, there's a bunch of resources. Like there's people that you can call. There's a great support system that you just call someone up and they'll talk to you. They'll help you out. Even with treatment planning too. Like if you had a question that you're not sure how to treatment plan a certain patient, you can just go in the back room, call practice support, and then they'll talk you through it as well.
Love it. Okay, we have quite a few more questions that have populated. We have a couple on COVID. I'll get back to those because I'm going to kind of just line those up. Another question just came up live. They're asking, do you have oral radiologists you can show abnormal pans, FMXs to, or do you usually call your oral surgeons?
I usually call my oral surgeon.
Okay.
If it was something that he would, like today, for instance, it's not that he wasn't comfortable. It's just something we don't do as much in the office. So at that point, we can refer to a nearby university or hospital for something like that. But usually I go to my oral surgeon first for something like that.
Okay. And like you said, I mean, you have that relationship with your mentor. You're working, Jeffrey, you're working closely with your POP. Do you just say, hey, can you come look at this? Like,
Oh yeah, all the time. Like today too. Like I had a new patient that had some growth in her mouth. I had no idea what it was. So I had him come in. He took a look at it. He's like, I have no idea what that is. So we just scheduled the oral surgeon that's coming
Yeah.
next week. So I mean, it's nice to have another doctor in there that you can always ask. But then besides from today, like I always ask him for help. Like even sometimes with like really complex extractions that I'm having trouble with, like I'll ask him, hey, can you take a look at this? Like give me your opinion on what you think I should do, and then he'll like help me out. He'll guide me through it and stuff like that.
And I'll give him a shout out. I was FaceTiming my dad a lot the first year, but then he was all like, "Oh, I don't want an iPhone anymore. I want a Android." So I can't FaceTime him anymore, and it's a lot more difficult to Skype someone. So I was like, I got to call someone else. you're too inaccessible now, Dad.
those Androids, I'm telling you.
I was like, it's just he doesn't hear the Skype call half the time.
Oh, I love it. I love it. So I know we kind of touched on this earlier, guys, but this question just popped up again. And they're asking, how did you decide between going into corporate / DSO versus private practice? And how did you decide on Aspen versus other DSOs? Now, again, we've touched on this, but did both of you guys know right off the bat that you wanted to work at a DSO, or you were just open to whoever was going to give you the best opportunity?
I was open to whoever gave me the best opportunity, and it just happened that a DSO or Aspen gave me what I basically covered what I wanted, which was mainly the mentorship and a bunch of CEs. Because I know a lot of private practice, they'll give you the mentorship, but then they may or may not have CEs, so they might not pay for your CEs. Whereas Aspen pays for or has a bunch on their own that are free already, and they also have others that your office may potentially help cover if you want to travel to do those CEs as well.
Okay, awesome. Now, Jimmy, let me ask you this. Kind of referring to that question, your dad, you said, owns a private practice, or had his own private practice, right?
He owns a private practice now. So in my case, he's not going to be retiring anytime soon. So there's not room for someone like me there. I'm sure if I wanted to, we could have explored that option. But just because when I was looking at different jobs or associates or DSOs, this was a way better opportunity for me, like to get the CE, have a good structure, basically make good money coming out of dental school with the possibility of becoming an MCD and owner and that kind of situation. So I definitely, I mean, you could ask anyone. I was never opposed to DSOs, but if you would ask me as a D1, I would have been like, nah, I'm probably just going to go into private practice. But I was open to everything. And that's what I tell people. Actually was in med school before I switched to dental school. And when people talk about specialties, they're like, oh, you want to have your mind open, because if you have tunnel vision, you kind of close yourself off to other opportunities. So I say, when you're in medicine, you want to be open to all kinds of specialties. When you're in dentistry, you want to be open to all kinds of practice situations, because DSO Aspen might not be the best situation for someone in a different area, in a different situation. But in most scenarios, because we're all over the country and there's so many offices, it is a very good, if not the best option. But some people it might not be. And I'm never going to tell someone this is what you have to do. Just be open. And a lot of times you're going to find that Aspen is the best choice.
I love that. Now, let me ask you this. Have you done some comparison with your dad's private practice? Like, do you guys sit down and kind of talk about how things work where you're currently working, and then, with him? What are some of those differences? Because I know that you guys don't take any business classes in school, right? Not really, at least. I'm assuming you guys come out of school not really understanding or knowing how to run a private practice. So with Aspen, a lot of people don't understand, and I'm just saying this for you folks that are on, all of our offices are individually owned. So Jeffrey, when you say my owner of my office, and then, Jimmy, you say Dr. Reddy, he owns all those offices. All of our offices are individually owned. Aspen Dental provides all of the support, right? So with your dad's private practice, does he have to hire a whole bunch of different people to help him run that practice? Like, what does that look like?
So in his practice, I mean, it's similar in ways and different in ways. So in Aspen, like we have like an owner that owns the office, but in an individual office, you'll have in my case, I'm the only doctor there. We have one hygienist, we have 3 assistants, and we have an office manager up front, and we have a PSR up front, who's kind of like the front desk person. And the office manager, and on top of that, outside of the office, you have regional managers, you have directors, you have senior directors. So basically, you have so many different levels of people watching numbers, collections, insurances, things like that, versus in my dad's office, it's either him having to do a lot of that kind of stuff, or he'll have like a office business manager, but kind of between the two of them, there's a lot more responsibility versus within Aspen. It's kind of spread out amongst a lot of people. And actually, when it comes to me as an MCD or associate, I have 0 responsibility of that. Like I actually may be a little more involved than some are. I go through the orders with my assistants and things like that, but you don't even need to do that if you don't want to. Like literally, they'll do the orders, they'll do all that kind of stuff. So you have very little responsibility other than just doing the dentistry, focusing on that. Now, on that note, the thing that's nice about being able to order things, because this might be a question, you can order kind of whatever you want that's on the formulary. So there might be a certain type of burr or a certain type of like flowable or composite. And if you want to try something different, you order it. Like my staff was giving me a hard time last week because I had, for the first few months, I kind of just went with whatever burrs they had there. But on the last order, I actually ordered just a bunch of different stuff. And I was like, I want to try it. And now I have my like 5 burrs. I was like, if I have these 5 or 6, I can do any single procedure. And I figured it out by ordering a bunch of different stuff. And you have that flexibility versus if you're in a private practice, things cost a lot and you don't have the deals that Aspen does. And you don't really want to waste money trying things. So you're a lot less able to try new things and see what works better for you. So that's another side benefit that I didn't even realize until like the last few weeks.
Right. Absolutely. Now, Jeffrey, do you feel like, are you involved at all in any of the business stuff? Or are you just practicing dentistry?
Just practicing dentistry, but as Jimmy said, if I want a handpiece or like a forcep or something like that, I just ask, hey, can you put this in our next order? And they'll just order it for me. So, but all the business stuff, our office manager takes care of that. The PSR takes care of all the billings and stuff. Insurance stuff, don't talk to me. Talk to the front desk ladies. They'll take care of everything for you. I'm just here to do the work for you.
Absolutely. And you know, like that is a huge, there's a huge disconnect when a lot of, when students ask or don't understand the difference between a private practice and a DSO. Not every DSO is different, right? Jimmy, a different DSO. Every DSO is going to be different on the model and what they cover and what they support. Now with Aspen, Aspen Dental Management is who I work for, Aspen ADMI. We are the support system for the owners. And like Jimmy said, there's a huge support system. So you have your owner who owns your office. And in your situation, Jimmy, your owner owns multiple offices, right?
Yeah.
So he's hired you and all these different, dentists to come in and run those practices as if it were your own. And then you have your PSR, which is a patient service representative, basically the front desk girl or whatever. You have your office manager, you have your consultant manager that helps with, do the consultations for when you guys are ready to kind of go over all that information with the patients. Then you have your regional manager, and then you have a director, and then you have all these levels of support, and everything gets done for you. So as an owner, you can be as involved or as uninvolved as you want. And I know that from experience, we do have some owners that are super involved and they want to interview every single associate and every single MCD. They want to be involved with every single DA that gets hired. And then you have some other owners that are like, Jimmy, if you want to interview someone, cool, I don't care. Or if you want your director to do it all, let them do it all, So, you as an owner or an MCD as hands-on and hands-off. But the great thing is that if you do want to learn, you have that opportunity to ask questions and, definitely learn. So I think there's a huge difference with the private practice. Cause like you said, with your dad, he has to do all this stuff, all this back office stuff, right?
He's like a doctor or dentist and a business manager in one. And it just, sometimes it's good in some situations, but sometimes it can be a little stressful, especially at the beginning of your career when, like you said, we don't have business courses, or at least our business management course wasn't really anything that you would need to know as a dentist. So
right. No, I completely agree. And I'm glad you brought that up, because a lot of, when we do a lot of lunch and learns, a lot of, the D4s will say, I'm going into private practice. And in reality, I'm like, if your dad or your grandpa or your uncle or someone doesn't own a private practice and you're kind of like, sneaking in there, what do you really know about running a private practice? Like all the stuff in the background that you don't really know. It's all
You better hope that the dentist is going to stick around a little bit to teach you, because you don't know that stuff. Like I don't know that stuff. I mean, even being in Aspen, I know a lot more now than I did a year ago, but you still are learning stuff every single day when it comes to the business side. So it's nice when you don't have to worry about it.
Yep, absolutely. So I'm glad you guys touched on that. So we have time for a couple more questions, guys. One just popped up, which I always love. How long is the work contract with Aspen? Now, I'm going to answer this just kind of really briefly, and then I'll give you guys an opportunity. Guys, we don't have contracts. We do have like a letter of agreement. We have, an agreement saying that you're going to come work for us. That agreement is a couple pages long. It tells you, your hours, how much you get paid, who the owner doc is, and all that good stuff. But there's no contractual period. So Jeffrey, when you signed on, and again, this is different across the board, right? If an owner doctor offers you student loan reimbursement or offers you, a sign-on bonus or any of these larger incentives, they might say, hey, I'll give you $50,000 or $100,000 in student loan reimbursement if you work for me for 2 years. I'm just kind of giving it that as an example. Or I'll give you a $50,000 sign-on bonus if you sign a 1-year contract and you work for a 1 year. That's when you'll hear the term contract. And again, every office is different, but that's only if they're offering you some sort of incentive to jump on board. But normally we don't have a specific contractual period that you have to stay with Aspen for. So Jeffrey, when you signed on, did you sign any specific contract, or was it just your regular letter of agreement?
Just my letter of agreement. It's like 3 pages long or something.
Right.
Not even long. It's like took me 10 minutes to read through it. So
yeah.
It's not bad at all.
The conversation that you've had with like your owner docs is, if you're not happy or if you decide this is not the right fit for you, I mean, what does that look like? If you were to want to leave? If
I wanted to leave, well, of course, if I'm not happy with the office and I still like Aspen, there's the option of transferring to a different office. So that way you'll still keep all your benefits and stuff like that. But if you want to leave, that's fine. In my letter agreement, I don't believe that there was any non-compete or anything like that in there.
Right.
So if you're not happy, you could just pack up, go next door if you want.
Yeah,
Nothing's gonna happen.
I'm glad you brought that up, Jeffrey, because like if you aren't happy with your office, specifically that office or specifically that owner or, another associate that's there and you're like, you know what, I'm just not vibing. This is just not my cup of tea, but I do love the company and I want to stay with the company. You have that opportunity to reach out to someone like me or to another recruiter and say, hey, I want to potentially look at other opportunities, right? Or other offices in the area. Or like you, Jimmy, you were moving from Virginia all the way over back to Ohio. You have that opportunity because we have so many offices nationwide, you have that opportunity to say, hey, can I transfer?
And it's funny because when I knew before I went down there that I was most likely going to be coming back here. So I actually asked, I might have even asked some of you guys, I was like, is there an office in the area I'm moving to? Unfortunately, there wasn't in the kind of the 15-minute drive I kind of wanted to be in, but that's it. Like you're saying, you can kind of go wherever you're able to.
Yeah. And I mean, it's happened a lot where, not really a lot, but where, a doc will sign on with us and they'll say, you know what, I love what I'm doing. I just don't really see eye to eye with the owner doctor, or we just, butt heads, or we just have a different philosophy and, but I want to stay. What are my options? It's like, let's look for another opportunity for you. And, we're all humans, right? So you might not love who you work with, or you might not, it might not work, and that's totally okay. Now, Jimmy, you said earlier, like, Aspen's not for everybody. We are fast paced. You are, Jimmy, or Jeffrey, you said you are seeing a lot of patients, and it's a completely different situation from when you were in school. So a lot of you guys, when you come out of school, you might think like, oh, I don't want to see 25 patients. Like, that sounds like a lot. Like you said, it might sound overwhelming, but we are fast paced. We do see a lot of patients. So Aspen might not be for everybody. So we want our letters of agreement to be very, very crystal clear and say, you know, if you aren't happy, we do ask that you give us a professional courtesy of giving us like a 90-day notice so we can get someone to, you know, to jump on board and to kind of take your place. But if you decide, like Jeffrey said, if you want to work next door or work across the street, that's okay, because we do not have a non-compete, and we don't have like a covenant saying you can't work within a certain radius.
I almost equate it to something Jeff said earlier when he was saying like we have too many patients, like he was kind of joking about it. But with Aspen, in terms of like someone leaving, or even in terms of like a patient not agreeing to or not wanting to do my treatment, at the end of the day, I don't get upset about it, because I tell someone what they want to do, or what I think is the best thing for them. And if they don't think it's right for them, just like if a person doesn't think Aspen's not right for them, Aspen's not hurting for doctors or patients. And they're like, if you opened up next door, yeah, that might be not a cool move to do. But at the same time, Aspen has its own patients. They get enough from insurances referring and things like that, where you can go next door and it's not going to hurt an Aspen office at all if you do that. And if a patient doesn't want my treatment plan and wants to go somewhere else where they can just get a prophy instead of an SRP, that's fine, because we have so many people that do need these scaling and replannings and will get them done. So it's like, in all these situations, I don't mean it to sound like a cocky or confident thing, but you do what's best for you. And I'm never going to pressure someone to get the treatment, and I'm never going to pressure a doctor to want to be with Aspen if it's not right for them. It's just, you need to find what's your fit. And if it is Aspen, and if it is kind of the office you're in, then great. And if not, you'll probably do well somewhere else too. So
Absolutely. Yeah. We're very much in the mindset of like, you know what, we want you to come work for us. And if you love it, fantastic. You have the opportunity for growth, right? Jeffrey, you hopefully will become an MCD soon. Jimmy, like you said, there is opportunity for ownership. So if you want to become an owner down the road, there's all these opportunities for growth. But if you decide, you know what, this is not my cup of tea, no hard feelings. You know, go check out a private practice or another DSO. And if you decide and you leave on good terms, hey, you know what, I had it really good over there, I might want to come back. That happens a lot too, where our doctors say, you know what, I'm going to go try out this other, you know, position. I think it's a better fit. And then they come back 6 months later and they're like, you know what, I feel like this was a better fit for me. And I wasn't making enough money there, or I wasn't happy with the patients, or whatever the case is. So vice versa.
that ties in exactly with what I was saying. Cause like, if you don't believe how many times, I've even seen friends that like, they were with Aspen, like maybe I'll try something different, and they come back. Or you tell a patient a treatment plan and they were like, want to price shop, they come back. If you treat people well, you're always going to have opportunities for you. That's what I always say.
Absolutely. Now, Jeffrey, with your treatment planning, I know that you just recently started. Are you doing all your own treatment plannings now, or are you still working on your mentors or your owner doc? What's that look like?
I do all my own right now. Yeah.
Okay.
Initially I did, before I did see any new patients, but now that I'm more in a regular routine, I have my own columns, I now just do all my own. Yeah.
Love it. Now we have to see the puppy. Oh my gosh.
His name's Taco.
Is that the
His name is Taco?
Taco. But it's like Tako. No, he's the
Like
first
the
one.
basketball player Taco?
Yeah.
just not as tall.
Yeah.
Just not as tall. He is so cute. I love it. I love it. Congratulations.
Thank you.
All right, guys, we have 2 minutes left. We have quite a few questions that are still on here, but I'm gonna kind of sift through. A lot of these are repetitive, but
You want to hit the COVID?
yes,
Yeah.
I want to touch on COVID because I highlighted a lot of the COVID ones. So talk to me about COVID in your guys' office. One of the questions that popped up is, are you worried about PPE shortage? What steps are you taking to make sure docs and hygienists feel safe? So what's the COVID situation in your guys' office currently?
Well, I'll take this. So when I came back, I was going to get a house or whatever like that, or a place to live, and COVID happened. So I'm actually at my parents' right now. My mom is, compared to a lot of people, super paranoid about COVID. So I come home from work, I hop in the shower right away, all that kind of stuff. And she was like, oh, she's really worried about all this kind of stuff. But in my office, I have more PPE than I could ever do. I have so many boxes of N95 masks, level 3 masks. Every single patient gets their temperature checked. I have hydrogen peroxide in the rooms. We have questionnaires before they come back. It's like so many different precautions to make sure. I mean, a patient could have been in my office yesterday and we asked them all the COVID questionnaire. They come the next day, we ask them the same questions. Did you interact with anyone? Like every single time they come into the office. So yeah, things can happen, but I mean, as much as you can, we do as much as we can to prevent it. So when I first got back, because COVID was new back in May, I was kind of worried about it, but I don't really think about it too much on a day-to-day basis, just because we have all these protocols in place.
Good. So you feel safe.
Yeah.
Good. Jeffrey, do you feel the same way?
Completely safe. Yeah. It's like all the N95s, level 3, disposable gowns, hair nets, face shields. It's everything. So you'll be fine.
It's actually made me better about PPE, because I'll be honest, before all this, I probably would walk into exams and I didn't have goggles on, or sometimes I'd like look in the mouth real quick, but now I make sure, and it's actually made me more conscious, and I'm probably going to be a lot safer even moving forward after COVID because of it. So
yeah,
it's a good side effect.
That's good. That's awesome. So one last question here, guys, and then we'll wrap it up. Actually, two, because someone just posed one. So I'll get to that, the one that whoever just posed one right now. So what changes are you making when you see patients now? So like you said, you're doing temperature checks. I was in recently to get my teeth cleaned, and I had to do like a peroxide rinse. What was that about?
They say it kind of kills
it,
helps, minimizes the effect of COVID. So yeah, I mean, anything that they say is a good thing to do. We just have them do, just to be safe.
Good. So you guys are following just all the protocols that
yep.
are there. Okay, awesome. So last question that just popped up live: how does COVID affect interviewing for jobs with Aspen? So I'll take that one. I'm assuming, have you guys done any interviews or shadows in your offices that you've noticed?
Go ahead,
Jeffrey.
My interview was through a Zoom kind of thing. So that was my interview for my current position, which was very informal too. It was my practice owner and our regional manager, and I think our director was there too in that Zoom call. So this is very informal. Just ask me like, where I graduated and stuff like that. It's no different than like a regular interview, except like you're at home in your own comfort zone and not like sitting in front of an office, like in front of a panel or something like that.
And hopefully you were wearing pants.
Oh yeah, I was.
I love that. So, Jeffrey, was your interview right when COVID hit?
Yeah.
Okay.
Yeah, it was right when COVID hit. So then initially I was scheduled to do an in-office interview, but then since COVID hit, they kind of like stopped us from his office had to be shut down. And then the other office I was interviewing at as well, like they stopped their business as well. So then I had all of my interviews all on Zoom and stuff like that.
Okay. And then Jimmy, have you been doing any interviews in your offices or shadowing or anything?
Ours haven't been for doctors, but just because our office is one of the bigger ones in Columbus, they kind of use our office to interview for front desk people or things like that. And they have done interviews, and basically they kind of go in a separate area. They're spread apart. They have masks. So it is more in person for those, especially these have been in the last month now that things have kind of calmed down a little bit, but they're still kind of keeping all the precautions for
Yeah. So we're still doing interviews, guys. So if you are interested in interviewing, please reach out. It really depends on the office owner, right? And the directors. You have some owners and directors that do want to meet the candidates in person, and they will say, yeah, let's set up, especially if you're local or if you're close enough to come into an office. They will obviously practice like social distancing and wearing a mask, but they're all for meeting you in person if that is an opportunity and if you are close enough. Otherwise, we are setting up Zoom interviews. We are setting up Skype interviews. We're doing phone screens. So there's definitely an opportunity for you to interview. So don't let, COVID stop you if you are interested in talking to someone about an opportunity. But that's our time, guys. You guys have been fantastic. I know time flies when you're having fun. It's already 8:34, my time. And we didn't get a chance to answer all the questions, guys. So if there's any questions that anybody posed that I didn't get to, and that's something you still want answered, reach out to me directly. I'm assuming the email that went out has my information, right? My phone number's on there, my email's on there. Please shoot me a message, shoot me a text, and I'll answer any of those questions. Would you guys, Jeffrey and Jimmy, are you guys available to answer questions too if anybody wants to reach out to you after this?
You can find me on any social media and just send me a message and I'll answer.
Yeah. Likewise.
Love it.
I'm sure
Awesome.
a lot of MW people still have my email, so I still check that once in a while, so just shoot me an email if you guys want.
Love it. So if anybody wants to reach out to these two awesome folks, please let me know. I will get you all their information. If you have any other questions, don't hesitate to contact me directly. And then lastly, we are still offering free CE courses for anyone that's in the dental industry. So that's students, educators, anybody that's in dental can log in to our CE courses. So and all those are certified CE courses. And there's, like Jeffrey said, thousands of courses available. So any of our students, if you want to log in, please shoot me a message and I'll send you the link. And those are absolutely free until March 2021. But that's our time, guys. Thank you again for joining us for this webinar. You guys have been fantastic.
Thank you.
I will probably invite you guys on for a future one down the road. But again, thank you. And for anybody that didn't, again, get their questions answered, please reach out to me. My email and phone number are on those emails. So you guys have been great. You rock.
Thank you.
Thanks.
Take care, everyone.
You guys have a great night. Take care.
Stay safe.
Likewise. I like how that's the new term, right? Stay safe.
Good
All right. Good night, guys.
night.
Bye.